Welcome to Western Wisconsin Journal. I'm Meg Heaton, and my guests today are among some of the most important and busiest people in St. Croix County as we continue to navigate through this unprecedented pandemic, COVID-19. They are Kelli Engen, the St. Croix County Public Health Administrator, and Elizabeth Klasen, the Epidemiologist with St. Croix County Health and Human Services. Welcome, ladies. Thank you very much for taking the time today.
Thank you for having us.
Well, we want to thank you, first of all, up front for all the hard work you've done over these past 18 plus months and for continuing to bring us the most up-to-date information about COVID in our county. It's a little cliche, but I would like to say we have to stop meeting like this. But let's hope the latest surge in the virus is the last, and that with continued vaccinations, booster shots, vaccine for younger children becoming available, we'll get past this soon. But we've got a lot to talk about today, so let's get started. It's been a while since we've talked. How are you and your team doing? Kelli?
Yeah, I did check. It's been since April since we talked last. So thanks for having us here. We like to get information out as we can. So since April, we had a surge in April of cases that started to decline in May. And then we saw a lot fewer cases in June and July, and Elle might hit on this as well. We even got to a point where we were releasing some of our limited term staff that we were having that we use to do our contact tracing and disease investigations, which was good. And then it was kind of this whole question of, oh, can we start our normal public health services again? We quickly learned that that lull was short-lived as we started seeing cases on the rise again in early August, and really have seen continued rise in cases. Elle, I don't know if you have anything to add kind of about the disease trends over the past 5 to 6 months here, but.
Yeah, I can definitely talk about COVID-19 and what we've been seeing. In the past couple months, especially kind of since really, as Kelli said, we went down in our June and July in our summer months. We saw under 100 COVID cases in St. Croix County in July. It went up to 600 in August. And then with the start of school, we actually doubled that amount. And now we were over 1,200 cases in September. In October, we have already seen over 1,000 cases as well of positive COVID-19 cases. So what we're really seeing with these trends and with this rise of cases is that our school-aged population, if we look at those who are making up the positive cases, it is really our school-aged population that is driving, since the start of September, that is driving this wave. This Delta wave that we're seeing here in St. Croix County. Unfortunately, with having a large vulnerable population gathered together within the school building, we have seen within school transmission. As I said, we've seen the majority of the positive cases be within those school-aged children. And as we've moved now into October, we are actually seeing a trend where the majority of positive cases are within that school-aged population, and they're also within the parent population. So within school transmission and within households transmission is really what's driving our Delta wave currently here in St. Croix County.
Is it pretty much across the board in the county that we're seeing this, or are there certain hotspots around?
We have seen certain hotspots. We have seen within certain districts, we have seen cases rise rapidly. And that is what happens when you start to get a few positive cases. Delta is so infectious that it will rapidly spread. Once you do have a couple positive cases, you do have transmission generating and starting, and then it does spread rapidly within certain areas, yes.
And how are these kids faring with the disease in terms of how virulent it is and how sick they get?
Right. So we've obviously seen now more cases than we have seen in that pediatric population than we've seen here in the county before. And with now the CDC and the state of Wisconsin have started tracking what's pretty much the worst outcome for a child. A multi-system inflammatory. It's within children. They are tracking the number of cases. It has risen. And so likewise across the country with the Delta wave, we've seen increased hospitalizations and we have seen increased deaths in the pediatric population. Luckily here in St. Croix County, we do not have a pediatric death nor currently a pediatric hospitalization.
But it is also spreading to their parents and anyone else they come in contact with, right?
It is. As you know from the data dashboard, which we have talked about that St. Croix County provides through our St. Croix County website, we have seen a definite shift in our hospitalizations and in the deaths of residents of St. Croix County. Previously, we would see hospitalizations and subsequent deaths from COVID-19 of our very elderly population. But now we have almost 90% of our 65 plus population fully vaccinated. So with having such a great population protected, we are now seeing an increased number of hospitalizations and deaths in a much younger population. Predominantly, and we can see from DHS data that is shared as well, that these are unvaccinated individuals. But back to the trends in hospitalizations, we're seeing younger. Unfortunately, in September, we had 8 deaths due to COVID-19. 6 of those were individuals in their 60s. And then in October, we have had additional deaths as well. 1 individual in their 40s passed from COVID-19.
You mentioned that the public, you've got an updated health advisory. Can you tell our viewers why this is so important and what recommendations are included in that advisory? Kelly?
Yeah, absolutely. So our advisory, we continue to look at it every couple of months to make sure that is still appropriate for the level of disease and the level of activity of COVID-19 in our communities. This advisory hasn't changed. We are still following the CDC's recommendations for both vaccinated and unvaccinated people to wear a mask when they are coming in contact with people outside of their household, especially indoor spaces. There's a full list on our website. Our advisory is on our website, but other places where we are recommending face masks be worn universally, whether regardless of the vaccine status, our healthcare settings, businesses, if they so choose to, have a sign that says, please mask while masks recommended, as well as our K through 12 school districts. So anytime you're congregating that many people together in an enclosed space, like Elle said, 1 to 2 cases can rapidly increase in numbers with how infectious Delta is.
Okay. And we are seeing that in terms of recommendations, can you clarify again, what does the county say about masking and where do we stand with that right now?
So as far as the county goes, I believe we have signs in our in the county buildings that say mask recommended. There is currently no order that says you must or you shall wear a mask. We are just following what CDC and DHS has recommended to keep our community safe, and that is masking in indoor places, whether or not, regardless of your vaccination status. So,
but because we have seen this increase now going up, it would be probably, if you had your druthers, I know it's not a mandate, but if you had your druthers, you'd advise people to mask up when they're inside and when they're with large groups.
Yeah, absolutely. We started implementing wearing masks. I think it was the beginning of August. I put mine back on at work. and we've continued public health since August and had conversations in the county about the recommendations to mask because of the very high activity level of disease spreading within St. Croix County.
And Elle, can you speak a little bit to, those of us, people who are vaccinated, we're seeing more and more, or hearing anyway, more and more about breakthrough infections of vaccinated people from Delta. Is that a real fact, or, can you speak a little bit to that about breakthrough infections?
Yeah, breakthrough infections do happen, but it is not anywhere near at the same rate as an unvaccinated individual would be infected.
Mm-hmm.
So the Department of Health through Wisconsin does share great data on this, but just to give you an idea, in the state of Wisconsin, in the month of September, out of 100,000 people who were fully vaccinated, there were 500 cases, people who did test positive, who were fully vaccinated. Now, of those 100,000 people who are not fully vaccinated, 2,351 people tested positive. And so if we kind of look at that, vaccines are, the end point is to protect against hospitalization and death. And in that 100,000 of fully vaccinated individual, there in September of 100,000, just makes it comparable, there was 1.3 deaths. Unfortunately, in those who were not fully vaccinated in September, out of 100,000 individuals not fully vaccinated, there were 24.5 deaths. Okay. So your risk of disease, infection, and severe outcomes such as hospitalization and death from COVID is at much greater risk than being vaccinated when you potentially may have a breakthrough infection.
So when we hear about these breakthrough infections, if you're vaccinated, the chances are that you will not have to be hospital. You will not have that severe reaction to COVID, the life-threatening stuff, right? Is that right?
That is correct. Yes. Okay. So you are protected.
That's across the board for age groups, kind of.
That is.
Obviously, people with pre-existing conditions are in a different spot, but is the Delta variant, I just heard a story about a former superintendent in Stillwater who was fully vaccinated, got quite ill in a breakthrough infection, but they said that it was because one of the reasons it was so severe was because he got it from an unvaccinated person. Is that possible? Or, I mean, is that something that you've heard too?
Well, unfortunately, I am an epidemiologist, which helps me deliver in data and trends, and really looking as a virologist or an immunologist who really looks at the viral load within individuals. I feel like cases such as this are a real example of we can't look at single situations to define what happens.
Yeah.
What happens on a whole is when we look at 100,000 people, such as the data from the Department of Health shows, and really look at the true trends. What is truly happening? What are the facts? We are always going to hear stories about weird things and potentially what is happening or why aren't things happening. But going to a source, and unfortunately being an epidemiologist, I am not the source for viral load specifically.
You've mentioned some important information. Let's talk a little bit about that St. Croix County dashboard. And you mentioned some of the information that's there. Can you talk about, how people get to that and how they should look at that and what's important on there in terms of, like, since school started, you've already mentioned some of those numbers. What other kind of information can people glean from that dashboard? And it's obviously very objective information based only on the numbers and the facts that are coming into the department.
Correct. So to start off, our data dashboard is located if you would simply Google St. Croix County, Wisconsin, COVID-19. We have a great COVID-19 page. It covers a lot of information related from everything from vaccines to testing. And then there is also a link for the data dashboard. Going to our data dashboard, that will tell you how many cases we've had so far this month, the percent of the full population that's vaccinated. It will also have a graph where you can really see kind of what people have called the epi curve. So we can see the raise and we can see the wave that we are currently in. We can see the rise in cases from a graph there. And so that is what we should be paying attention to is, are we lowering the curve? And then secondly, there is a graph that does show you the distribution of cases by age group. So we can really look who is driving transmission right now in St. Croix County, who is the most affected by testing positive.
Okay. And either one of you, currently the Pfizer vaccine is available for adolescents and people 12 and older. Is that correct? And do you have any information about when it'll be available for kids younger than 12? Kelly?
Yeah, so the Council on Immunization Practices have meetings scheduled. They met today, and they also have meetings scheduled for the first week in November, the 2nd and 3rd, and there will be a vote to whether or not that they will approve under emergency use authorization vaccines for that 5 to 11 population. Everything we're hearing from our sources of information say that that vaccine will likely be approved. So looking for that hopefully as soon as like the 2nd week in November. So we can start getting that younger school age population vaccinated.
And is there some place for people who are concerned about vaccinating their kids at that age, some place that you would recommend that they go to read about the efficacy of the vaccine, the safety, the clinical trials? Where should they go?
Yeah, I think that's a great question, because I think there's a lot of misinformation related to vaccines, kind of all about social media right now. So good resources of information are actually the FDA, the Federal Drug Administration, as well as the vaccines themselves. They, the manufacturers, so Pfizer, Moderna, they all have websites that really talk in depth about kind of the studies and where their approvals are at, and all kinds of information related to those specific vaccines. Johnson & Johnson is another one, obviously not for the younger population. I think another thing that I would like to point out is that the smartest thing I ever heard somebody say about a vaccine that's manufactured so quickly is it's okay to be skeptical. It's good to be skeptical. It's not okay to be cynical. And I do think we have to find people in our lives, if people do have questions related to vaccines, someone they can trust, preferably a healthcare provider, but get questions and their fears or anxieties talk through with somebody who can really have a honest conversation with them related to vaccine, because we've given a heck of a lot of vaccine, but we still have a lot more to give to end this pandemic.
Will the county be involved in getting the vaccine to the 5 to 12-year-olds?
Yeah, great question. So we currently have conversations with our school superintendents on a weekly basis. And of our 6 districts, we do have about half who said, yes, we would be interested in having a clinic or coordinating to get our younger school-aged kids vaccinated. We also have COVID vaccine clinics on Mondays from 12 to 4. All this can be found on our website, because currently booster vaccines are available. Now today, as of today, DHS at Wisconsin gave the official word that vaccinators in Wisconsin can also give booster Moderna boosters. We recently had been giving Pfizer boosters, so boosters are available. And pharmacies, clinics are all giving booster doses as well in our St. Croix County area.
And the boosters are available to who? Let's clarify.
Yeah, we can definitely talk about that. So as of today with Moderna, so you know, anybody who is 65 and older, anybody who works in a high-risk occupation. And I'll tell you the stance we've taken related to high-risk occupations in St. Croix County. If you present and say you want a booster and you do X, Y, or Z, there's probably not a lot of things that will say, no, you're not eligible for a vaccine. If you're out in your community and coming in contact with the public, it is likely boosters, you're likely eligible for a booster. We aren't checking, you'll see a lot of times on boosters that people with certain medical conditions are eligible for a booster. We're not asking for any verification of those medical conditions. We're taking people at their word and getting them their booster doses.
So there's plenty of those booster doses available then, right?
Say that again?
There's a lot of, there's plenty of the booster doses
Yes.
available. It's not kind of
Vaccine,
like,
yes, vaccine availability is not an issue we have seen in quite some time.
okay, good. You had also mentioned that there's obviously been an increase in hospitalizations and even deaths, unfortunately. Can you talk a little bit more about that? I mean, is that something we're continuing to see and you expect to see through the end of the year, or will that be tapering off based on your crystal ball?
Right. Like, I didn't bring it with, but so what we have to realize is that more cases in our county equals more hospitalizations and more deaths.
Mhm.
And so what we really need to do is control the transmission in St. Croix County. We need to drop the curve and come out of this wave. And then with lowered transmission, we don't have as many people testing positive. We don't have those individuals who then do have an infection that causes hospitalization and then potentially causes death. So really what we're focused on here at Public Health is controlling the transmission. That's why we make the calls to people who test positive, as well as giving things such as our health advisory, which I should have mentioned is also located on our data dashboard for people to, a link to our health advisory is on the data dashboard, as well as our masking recommendations are there for people to use for reference.
And most of these new cases occur with unvaccinated people. Is that fair
So
to say?
the data from DHS in Wisconsin will tell you that, yes, that new cases. St. Croix County, being a smaller county, we have not released our breakthrough data information
Okay.
at this time.
Now, as I understand it from the dashboard, there's about 55% of the total population in the county has been vaccinated against COVID. Are you concerned that that's kind of a low number in my mind, considering the size of the county and, you know, the good information that has been out there from you guys and others? Are you concerned about this, that more people in the county are not getting vaccinated?
I think it kind of speaks for itself. We are looking at a very serious wave here in St. Croix County. We're looking at over 1,000 cases in 1 month. We aren't that big. So that is a true significant number of people testing positive. And we are looking at hospitalizations. We currently have over 20 people just within our area hospitals. It doesn't even count people who are being treated for more severe disease who have been sent to the hospitals in the Twin Cities to be treated.
Now, what is the situation in our hospitals? Where is the census at? I mean, do we have enough beds and that kind of thing?
For the past, I would say since the middle of September, since early on in September, we have had very low availability, as well as the Twin Cities also are in one of the lowest availability, even so they're on divert. Within this past week, St. Croix County, the Western Wisconsin Hospital region, which includes hospitals in Polk, St. Croix, Pierce, we have now changed from being kind of in the red zone with having 0 to 5 beds available to having more. So we have transitioned to the yellow zone. But that is very dependent and can change at any time with our current case numbers.
And it also has an impact for people who need hospitalizations for things other than COVID, I would assume, right?
Yes, unfortunately.
Are you finding a trend? One of the things we hear about is that people are avoiding going to the doctor or getting hospital care because of COVID. Are you is your experience bearing that out?
So our experience in public health, we aren't a primary healthcare provider. Our services don't necessarily give that healthcare direct patient care service. However, we do communicate weekly, every other week with our hospitals, and we have absolutely heard this through the last few months, that over that initial period of the pandemic when everything was essentially shut down, and even beyond, when people were not out and about and seeking everyday life as we once knew it pre-pandemic, definitely hospitals have reported that care either follow-up care or even going in for a new problem or new health issue has definitely been delayed. I think there's a lot of research on this. The research that we are going to have after this pandemic, once people can really start, and not that people aren't researching it now, but once this is over and we can really take a look back, I think the information that we're going to learn through these last 24 months, it is going to be quite amazing. So yes, Meg, to your question, we have seen and heard of delayed care related to their health besides COVID. Yeah, for sure.
One of the other things is that, you know, I think people, the talk is generally now all about vaccines and boosters and getting kids vaccinated. Can we talk a little bit about testing and why testing continues to be so important?
Yeah, absolutely. So Elle probably articulates this better than me, but if we aren't testing, we truly don't have a picture of what disease looks like in our county. So testing continues to be really important. We have encouraged schools and really the general public for that matter, even the slightest COVID symptoms, which are listed on our website as well, people should get tested. People should also should get tested for COVID if they have been in contact with someone who has recently tested positive. Testing is definitely, it helps us quickly identify disease and then do contact investigation for, or allow the positive case to alert their contacts to know, because that essentially is one of the primary public health interventions right now of really stopping the spread of COVID. I don't know if you have anything to add related to testing, Elle.
I would just say, yeah, like Kelly said, testing allows us to know that allows you to know that you're positive and to take the next steps necessary to stop transmission. And then once you test, the laboratory does submit to public health, and then we can call you and give you additional advice on how to prevent transmission, which is the goal.
If someone hears that they've been exposed to someone with a positive COVID test, how soon should they be tested? Or, you know, when are their test results really legitimate or really tell the tale?
Yeah, that's a great question. And there's been some not misinformation, but backing. CDC did say earlier this summer, and I believe it was because of the Delta variant and how fast we were seeing after an exposure, people become symptomatic and ill. They had tightened up recommendations for getting tested sooner, like 3 to 4 days. They since walked that back last week and really want those people who are vaccinated. So it's different depending on your vaccination status. Those who are vaccinated to test 5 to 7 days after an exposure, and those who are unvaccinated to as long as they aren't showing symptoms, wait 6 to 8 days. We'll have a graphic updated related to when to test too, because timing of testing can be important in identifying true disease.
And testing sites that are available around the county can also be found on the website. Is that correct?
Yes, they can. We recently did get since the beginning of the response, the Wisconsin National Guard has been an important player in providing testing across the state of Wisconsin. St. Croix County has secured the Wisconsin National Guard through December 8th. And they will be at our highway shops again. Testing started last week at the Baldwin Highway Shop. And this week, tomorrow, a new location where they haven't been before, the highway shop in Deer Park, Wisconsin. So then next week, it'll alternate back to the highway shop in Baldwin. So we'll have alternating sites for testing free of charge to the person being tested.
Okay, and then people can probably get them at their clinic or whatever as well.
Yes,
right?
absolutely. Clinics are still doing testing. I know there are various places in the cities also that are doing testing. I believe pharmacies are still testing as well.
Mhm. Okay, and because we've been talking a lot about the booster shot, people can still get both the first and second dose of the COVID vaccine at the same clinics where they go to get the booster. Is that correct?
Absolutely. I think there's a lot of, if you've decided now is the time I'm going to start my COVID vaccine series, absolutely check with your healthcare provider to see how they're scheduling those appointments. Again, public health on Mondays from 12 to 4, we would absolutely start a series for somebody who hasn't had a previous vaccine.
Are you guys giving the booster shot too, or
Yes.
not? Yeah.
Yes,
okay.
we
So
are.
they can call you the county then.
Mhm.
Let's talk a little bit. We have the confluence of the flu season along with COVID this year. Can people get their flu shots at the same time as getting the booster or the vaccination?
Yep, absolutely. Recommend it. It saves you time and travel to get them both on the same day. There is no contraindication to having both vaccines in one day.
No problem with that.
No.
And that I would assume is going to be the same for adolescents and children as well.
Yes.
Okay, so good. Yep, got mine at the pharmacy while I was standing around. So it worked out really well. Is there anything else that we haven't touched on that you'd like people to know about?
I think that we are 19 months into a very long pandemic. I think we are going to continue to see spikes and peaks and valleys. Elle talked about a curve and flattening of the curve. And if you look on our data dashboard, our disease hasn't been a bell-shaped curve, right? We haven't had one spike. We've had multiple spikes. It looks like a little roller coaster. Some days it feels like that's what we're on too. So just realizing that COVID isn't over. We do want to protect the most vulnerable people in our communities. Those are immunocompromised, those people who can't receive a vaccine or who aren't yet approved to receive a vaccine. So keep informed and understanding that COVID is still here.
Elle, anything to add?
No, I think that really the only little piece I have to say is as you do look around, it may seem like COVID is not here, but it is. And just to pay extra caution as the holidays are coming up, because as you gather with people who are not vaccinated, as you gather in larger numbers, your risk of contracting COVID-19 goes up. And everyone's risk as anyone gathers goes up. And that only prolongs this disease within our community. So do be vigilant and know that it's out there.
And there are some wearing a mask is a pretty simple way to avoid this. And we've seen this happen. I mean, last year when we started to gather again, that's when everything surged up again. Then when things got better, and in the summertime we started to gather, we know, when we have clear evidence now over 19 months of what happens with these spikes and peaks and valleys. So hopefully people will pay attention to it, and we can give people like yourselves, the frontline workers on this, a break. So you can return to your families and your normal lives as well. I want to thank you both again very much, not just for being here today, but for all the incredible work you've done and how you've kind of created a whole new model for how this should be done. And we're fortunate in St. Croix County to have you at the helm and to have as much information at our fingertips. I would encourage anyone out there with questions to seek out the website of the county and to seek out these women and all the others that work for that are working so hard to bring this to an end. And again, hopefully we will have a very good Thanksgiving, a good Christmas, and an even better one next year. So thank you again, ladies. We appreciate it.
Thanks for having us.
Yep.
Thank you.